Have you ever woken up suddenly in the middle of the night gasping for breath as if you were drowning, but you're nowhere near water? I really hope you haven't. This can be a terrifying situation. But it could be that fluid is building up in your lungs, and if you live with heart failure, then this might be your body's way of waving a red flag. This can be an urgent situation, and you should seek medical attention immediately. But there can be slower development of these types of situations and degrees of these symptoms of heart failure, including difficulty breathing whilst doing simple activities. In this video, you will learn what pulmonary edema or fluid on the lungs is, why this happens, what does it feel like, and what should you do about it. So, what is pulmonary edema? Let's break it down. Your lungs aren't just empty balloons, they're made up of millions of tiny little air sacs called alveoli, where oxygen passes into the bloodstream. And in a healthy state, the walls of these air sacs stay relatively dry. There's air coming in, which allows oxygen to cross and carbon dioxide to move out. But in pulmonary edema, fluid starts leaking into these spaces. Now imagine trying to breathe through a sponge that is soaked with water. It's heavy, stiff, and impossible to squeeze air through. And that's kind of what it's like when fluid collects inside your lungs. Why does this happen? Well, in many people who have heart failure, the problem begins in the left side of the heart. When the left ventricle becomes weak or stiff, it can't pump efficiently. Blood backs up in the lungs, increasing the pressure in the lungs or the pulmonary vessels, and over time that pressure forces fluid out of the bloodstream and into the air sacs or alveoli in the lungs. And these are really important spaces that exchange the oxygen from the air into the blood vessels that then get carried to the rest of the body. So in this situation we have a normal chest x-ray. Basically, you can see the ribs, the heart, the spine. These are the shoulders and this is the diaphragm. And these spaces here that are largely black are black because air will be represented this way. However, in this picture, you can see that a lot of that darkness is gone and replaced by these blotchy white patches. This is actually fluid in the lungs, and you've lost all that capacity for air exchange. So that's normal versus heart failure in a chest x-ray. That haziness that you can see and the enlargement of the heart and the patchy white stuff at the bottom of the lung spaces, that's the pulmonary edema. And this is a dreadful situation and often a medical emergency. So what does fluid on the lungs feel like? The symptoms can come on gradually or suddenly. You might notice difficulty breathing when lying flat, waking up at night, gasping for air, needing extra pillows to sleep, sudden weight gain over a few days, swollen legs or ankles, a bubbling or crackling sound that you hear in your chest when you're breathing. It's not just shortness of breath, it's a progressive flooding that can become an emergency if not caught early. What should you do about it? Well, if it is sudden and severe, then this is a medical emergency. Call for help immediately, especially if you experience chest pain or discomfort, confusion, frothy sputum, or severe breathlessness. And if the symptoms are more gradual and less severe, you should still seek medical assistance. Speak to your doctor for specific advice. There are things that you can do to help manage the problem. If this seems familiar, then there's a lot you can do to stay on top of things. 1, weigh yourself daily at the same time in the same light clothing or no clothing. A sudden gain of 2 or 3 kilograms over a few days can mean fluid retention. This might be the most important warning sign that you can have. You should ask for medical advice if this is happening. Timely intervention could mean the difference between ending up in hospital or staying free of problems. Stable weight means stable levels of water in your body. A sudden increase means trouble. 2. Stick to fluid and salt limits if you've been told by your doctor. Your care team will often recommend 1.5 to 2 litres a day of all fluids and a low sodium intake. Increased salt in your food or drinks increases the amount of water retention that can occur in your body. 3. Take your fluid tablets or diuretics as your doctor has prescribed. These medications help remove excess fluid from your body through the kidneys. Getting rid of the excess water is a simple equation. What comes out of your body must be more than what goes in. If nothing is changing, then this equation needs to be rectified. That's when your doctor can help. 4. Track your symptoms. Use a diary, a notepad, or an app to monitor your changes. Breathlessness, leg swelling, and fatigue can be signs of trouble. So, fluid on the lungs isn't just a lung problem. It's a heart issue. It can be your heart saying, I'm struggling. But with the right knowledge, a sharp eye for change, and good teamwork with your healthcare provider, you can stay ahead of it. Keep listening to your body, know your numbers, and remember, every breath matters. I'm Dr. Jodie-Ann Senior, and I believe that knowledge is power, especially when it comes to your heart health. See you in the next video.